Welcome to Med Madness, your go-to podcast for all things medical. Today we're diving into a crucial topic for medical students and professionals alike, mitral valve prolapse or MVP. Understanding MVP is vital for accurate diagnosis and effective treatment, as it is a common valvular heart disease that can significantly impact a patient's life. In this episode, we'll cover what MVP is, its causes, pathophysiology, symptoms, diagnosis, management, and treatment options, and even walk through a real-world case study to solidify our learning. So, let's get started. Mitral valve prolapse, MVP, is a condition where the valve between the heart's left atrium and left ventricle doesn't close properly. This improper closure leads to the valve leaflets bulging or prolapsing upward into the left atrium during systole, sometimes causing blood to leak backward. The most common causes include myxomatous degeneration of the valve, connective tissue disorders like Marfan syndrome and Ehlers-Danlos syndrome, and occasionally rheumatic heart disease or sequelae from infective endocarditis. Pathophysiologically, the mitral valve leaflets become thickened and redundant due to mucopoli, saccharide deposition and collagen disruption, leading to their abnormal displacement. Next, let's discuss the symptoms and clinical presentation. Patients with MVP often present with a range of symptoms, including palpitations, chest pain, fatigue, and sometimes shortness of breath. On physical examination, a characteristic mid-systolic click followed by a murmur of mitral regurgitation can be heard, particularly at the cardiac apex. This murmur becomes less prominent with maneuvers that increase left ventricular volume, such as squatting. Now, let's move on to diagnosis. Diagnosing MVP involves a combination of clinical examination and diagnostic tools. Auscultation can reveal the distinctive mid-systolic click and murmur. Echocardiography is the gold standard imaging technique, providing detailed views of the valve structure and function. Additional tests may include ECG to assess for arrhythmias, and in some cases MRI for further anatomical details. Next, let's talk about management and treatment. Treatment for MVP focuses on managing symptoms and preventing complications. Medical management may include beta blockers for palpitations and ACE inhibitors to reduce afterload. In severe cases with significant mitral regurgitation, surgical repair or valve replacement might be necessary. Lifestyle modifications, such as regular exercise and avoiding caffeine, can also help manage symptoms. Preventive measures include regular monitoring and maintaining a heart-healthy lifestyle. Let's consider a case study to bring these concepts to life. A 45-year-old woman presents with intermittent palpitations and fatigue. On examination, you hear a mid-systolic click followed by a murmur at the cardiac apex. An echocardiogram confirms the diagnosis of MVP with mild mitral regurgitation. The patient is managed with beta blockers, advised on lifestyle changes, and scheduled for regular follow-ups. Her symptoms improve significantly, illustrating the importance of early diagnosis and management. In summary, mitral valve prolapse is a common but significant condition that requires careful attention. Early diagnosis and appropriate management can greatly improve patient outcomes. Remember to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Thanks for tuning in to Med Madness. Until next time, stay curious and keep learning. Thank you for listening to Med Madness. If you enjoyed this episode, be sure to subscribe and leave us a review. Check out our website for more resources and interactive content. Stay tuned for our next episode where we'll delve into another exciting medical topic. Goodbye and take care. This concludes our script for the podcast on mitral valve prolapse. Make sure to utilize the tools and resources we've provided to deepen your understanding of this important condition. Happy studying!